everybody. It's Jill, and we'll go ahead and get started. We're a few minutes after 12 o'clock. I just wanted to give everybody a chance if they're getting on their lunchtime, they're trying to get onto the this presentation. I want to give them a little bit of time to be able to do that. If you have questions or concerns, please do fill out a question, send it through the chat box. We do have everyone muted because at this time we don't have we're not sure of the capability of being able to filter everybody's questions. So if you have questions, please just send it through the chat box and I'll get to that. And this is I think our fourth virtual diabetic education that we are doing this year. This is new to us. We usually meet monthly in person, and we are really missing that. So this is new to us, and we're hopefully going to change it next year. Excuse me. Maybe be able to add more where we can actually have some chatting truly going on during this time instead of just me talking, because it is a lot more meaningful and we can actually have everyone sharing their information. I think everybody learns a lot more and it becomes more meaningful. So, but this time we're going to do it about the same way, and then just share any questions or concerns you have through the chat box, and we'll get to them near the end or if I see them pop up. But we decided to do a presentation on managing diabetes in a time of crisis because everybody I meet with, I am a diabetic educator. That's what the Certified Diabetic Care and Educational Specialist, those letters after my name, stand for. And everyone I meet with and I educate here at Valley Professional, we're all concerned with COVID. We're all concerned with just illness in general. But overall, we really need to be prepared and planning for this no matter what. It could be a personal illness. It could be an illness in the family. It could be a natural disaster. And so it's always good to be prepared, so that with diabetes, it's hard enough to manage and when times are going smoothly. So in times whether it's an illness or an emergency, something that comes up, it makes it even more difficult, but even more important to manage blood sugar and keep it well controlled. So we thought we've always covered something like this in the diabetic group, at least every 2 years, if not every year, we tried to cover it, especially during those times of the year when sometimes it seemed like, tornado weather or storms would be more something that we were more concerned about. And now with viruses going around, seems like that's the number one thing on our mind. But we always covered it because the American Diabetic Association, the American Association of Diabetic Educators, I should say, or it's now called the Association for Diabetic Care and Educational Specialists. They changed their names when they changed our title. Instead of being called a certified diabetic educator, it's that certified diabetic care and educational specialist, that longer title that we now have. But it used to be called the AADE. And if you do a search on the internet and you put AADE in, you can get all kinds of information, education. And they have always reported these 7 self-care behaviors. And what they have shown is that through research, if a person who has diabetes actually pays attention to these 7 areas and actually works on those 7 areas to get better control, you will see better blood sugars. You will see more controlled blood sugars, well-controlled diabetes. So that's why I'm always trying to focus on them. We have focused on monitoring. The first time when we went over continuous glucose monitoring, we went over healthy eating, what can I eat? And this time we're talking about reducing risk. And that's where managing blood sugar during a time of crisis would fall under reducing risks. So, and I want to definitely point out that, I get all my information from the AADE or the American Diabetes Association, but also a lot of the things that I will say and the things I put in these slides are things that I know our providers here at Valley Professional, or specifically Dr. Rico, who's an endocrinologist that works for Valley Professionals twice a month. I work with him. And these are the things we do with our patients that we are helping to help manage their blood sugar. What I'm going to suggest to you is, as we go through these ways of managing during times of crisis, you talk to your doctor or your nurse practitioner, your healthcare providers, and decide what's best for you, because every patient's an individual, and I'm sure they have their own research they use and what's worked best for them or their patients. So I always suggest that you talk to them. You don't have to take what we say. You don't have to take what the American Diabetes Association says. Always talk to your healthcare provider and then work out a plan among yourselves. But we are focusing on the reducing risk self-care behavior this time. I always like to point that out. So one thing we always talked about in our diabetic group where we actually met are what are some of the things we have to worry about in Indiana? I mean, we're in the middle of the United States. We don't have some of the concerns that other states have. But when we actually started doing some brainstorming, we actually came up with quite a few things that we do kind of have things we should be concerned about or prepared for. We don't have to be concerned if we're well prepared. So I put some pictures up here, and of course the blizzard, we always know that's a possibility here in Indiana. Floods can be a possibility, but we're right around the Wabash River, so that's not out of the question. And I think there have been times when, like the small towns of Montezuma, I've seen the river get pretty high there in Clinton as I've gone across the bridge. Earthquakes are always something that here in Indiana might be a possibility and have been, not as bad as they are in other states, but we have had some. I guess a possibility of a fire if we had a dry season, which we have had those before. Family illness can be considered, a crisis also. I mean, a lot of times that's when I notice people, they stop taking their medicine, they stop taking care of themselves because they're taking care of their family member who's ill. And then, of course, personal illness. If you get sick, you're not always, ready to take care of yourself or feel like taking care of yourself. So, I think, in this last year, I guess, 18 months, we've had the pandemic and, with everything going on, I think it's time for us to truly stop procrastinating and truly start paying attention. What do we need to do to be better prepared? Because there are two ways you can react to the knowledge that a disaster or an emergency or a family illness, a situation like this will occur. You can either do nothing or you can do something. So I think it can become very easy this day and age for us to wait to the last minute to call in our medication and get a refill. It can be very easy to call the last minute and get an appointment with our doctors, a last minute to the pharmacy to pick up the medication. I mean, I don't know how many times I have patients call and say, hey, I'm out of my insulin, and so it becomes kind of an emergency. And so that becomes very easy because we always know that pharmacy's open for us and the doctor's always there to fill that prescription. We run to the store at the last minute because they always have stuff on the shelves that we need. I think this last few months we've noticed, or maybe in the last 18 months, we noticed there are things not always on the shelf, and maybe we need to be a little bit better prepared if we're going to truly look out for ourselves and stay healthy. So it doesn't always work, as we've noticed in the last 18 months, to wait till the last minute. So emergency planning is important for everyone, but when you have diabetes, it requires even more planning and gathering of supplies than for someone who doesn't have diabetes. Diabetes doesn't go away during times of a crisis. It can be compounded because stress and illness can actually cause blood sugar to go higher. And yet, a life crisis or an illness can make it more difficult to manage. But during a crisis, it's easy to stop eating, to stop exercising, to stop eating healthy, stop taking your medication, to cancel doctor's appointments. That's what all happens during these times of crisis. That's what can happen. And so if that's true, then what can we do to be better prepared during these stressful times? That's what we're going to talk about today. That's what we're going to look at, some ways that we can do that. Well, we can procrastinate. And that's what I wonder, are we procrastinating or are we just too comfortable because we've had it pretty easy, pretty nice here in the United States where medication's always readily available and everything, the shelves are always full. So the question is, for you to start asking yourself, is this it? Am I procrastinating? Am I just too comfortable? And I think ask yourself, are you prepared? Have you been putting off things for later that really you need to get ready now? It's always important to be prepared for sick days and emergencies. So maybe one thing I think the last year has taught us, I hate to say something good that came out of COVID, but there have been a few things. We talked about that during the first presentation with continuous glucose monitoring. One of the good things that's come out is insurances have allowed patients to get continuous glucose monitors a lot easier, and we can remotely monitor. So we're keeping up on blood sugars, we're calling the patient. We don't wait 6 months to see them. That is actually a good thing that came out of the pandemic. This might be another one where our eyes are open. It's like, no, we're going to take some of this control back. We're going to actually start doing something to look out for our health. All right, so if we're going to do that, managing diabetes during sick days, it's never too early to plan ahead. There are 5 things that we're talking about managing diabetes during sick days that I think we could focus on, just simply five things. We're going to take each one of these one slide at a time. When you're sick, it's not time to throw in the towel. I know a lot of people feel like that because you don't feel well, but it's actually a time you actually have to start paying more attention to blood sugar. It's time to follow a plan. So if you have a plan, already in place, it's easier to kind of go pick up that plan and follow it than to have to think of things on your own. So if we take each one of those 5 things one at a time, the first one was monitoring blood sugar. Check more often. And you're like, what does that mean, check more often? Well, if you are taking insulin and you're checking your blood sugar 4 times a day, at least do that. Check it 4 times a day, each meal and at bedtime, maybe in between if needed. Check even if you don't take your insulin. So say you're not going to eat a meal, so you're not going to take maybe your meal insulin, you can go ahead and still check your blood sugar. And if you don't have a continuous glucose monitor, but if you're interested in getting one, during times of illness, it's a lot easier to just scan your sensor than it is to do a finger stick. And it's easier for your loved one also, if someone's at your house, to scan your sensor and find out what your blood sugar is than to do a finger stick. So, that's something you might think about talking to your doctor about. If you come here to Valley Professional, of course, I can help you with that. But, and just as a side note, I get no kickbacks from these continuous glucose monitor companies. I keep saying I need to get them because I keep suggesting people get these CGMs, but I don't. But I just see the benefit for our patient and for helping you self-manage. So I always want to mention that. But even if you don't have that, you can still do finger sticks. And when you're sick, it's better to do it more often than what you would have done in the past. So if you used to do it once a day, do it twice a day. Or if nothing else, pay attention to low blood sugar symptoms and high blood sugar symptoms. Now, the problem with that is I was putting some of these pictures on, and then I just wrote the words out for high blood sugar because I thought nobody wants to see a picture of someone vomiting. So some of these things are the same symptoms that you might have when you don't feel well. So I think it's going to be really hard to tell, am I having low blood sugar? Am I having high blood sugar? Unless you do a check, because some of these, your weakness, fatigue, you're irritable because you don't feel well, you're dizzy, you might be sweating if your fever's breaking, you might have stomach pain, you're very thirsty. But some of them are a little bit more specific to low or high blood sugar. I think the main thing is to pay more attention to them and don't ignore them and think, oh, it's just because I'm not feeling well. Go ahead and do a finger stick. Go ahead and check your blood sugar if you're having these symptoms. So monitoring is one way, monitoring more often is one way of actually doing a better job of managing blood sugar when you're sick. Another way is to continue to take your diabetic medication. So a lot of people, when they're sick, they don't feel well, or when there's an emergency in the family, that's one of the things they stop doing is they stop taking their medication. Unless your doctor has told you to stop, go ahead and be sure to take your medication. Oral medications, if you happen to take your oral medication and you end up vomiting, don't retake another one, because we don't know how much of that medication actually got into your system before you vomited. So don't take another dose until it's time for that next dose. If you're taking long-acting insulin, which is very slow acting, it works over 24 hours or even longer, it's slowly released in your system. That is one insulin that when I work with Dr. Rico, that we will tell our patients you can continue to take that even if you're not eating, because it's a long acting, it works very slowly, it's not likely to cause low blood sugar, especially by itself. Now your fast acting insulin, or the insulin that you usually take with your meals, that's one that we would usually say don't take that unless you're going to eat a meal. However, you may have your doctor, and we have done this too. If you call and you have a high blood sugar, there are times the doctors will instruct you to go ahead and give a little bit of that fast-acting insulin, even if you're not going to eat, but it can help bring down that blood sugar. But that's always a good thing to call and ask, because there's high blood sugar and then there's very high blood sugar. So anything over 500, we wouldn't necessarily suggest that. We might suggest the ER. So, but there are, take your medications as best as you can. Don't stop taking them. I know it's not an easy thing when you're not feeling well. Another thing that's not easy to do when you don't feel well is eating, and especially if some of you have had COVID, and I have, I didn't have taste, I didn't have smell, I didn't feel like eating. However, it's important to continue to try to eat. And so having things on hand already in your house that you like to eat when you're sick is always a good idea. You need to try to eat something. And if you can, eat your normal meals. If not, then all of these examples are about 15 carbohydrates, give or take. It's easier for your body to digest carbohydrates than proteins and fats. And So sometimes it's just our body, and our body's trying to heal itself, so it needs the energy, and these foods can give it some energy also while it's trying to heal itself. But these are also things that are kind of just easy on the stomach. And so, whether it's a popsicle, sherbet, just plain old chicken broth, or just some crackers, applesauce, anything you can get in that won't upset your stomach, but will give you some calories and some carbohydrates to get your body working, then that's what we're going to suggest that you try to do. And all of these things, there's a picture of a box there with food in it. Later on, we're going to talk more about getting together a sick day box or a go bag, if you want to call it that, for times of emergencies. But you should always have a box or some kind of container in your pantry or in one of your cabinets that has food in it that you like to eat when you're sick. Everybody has certain things that they always go to when they're not feeling well. In this case, there's a list of foods, and all of these foods can be put in that box, and they have a long shelf life, so they're not going to go bad, well, except like sherbet or popsicles. You can't hardly put those in the box, they'll melt, but you know what I'm talking about. Put those in the freezer. But have these things on hand, and just always make sure you have some, so that you have something to go to and you're not left with nothing to eat. And also what you like to drink. Like this has a cup of sports drink, but think about, if you like Sprite, if you like juice, make sure you have some of that. And again, those have a long shelf life. They're not going to go bad in a week. They'll last probably about a year. Another one of the 5 things to do when you're sick to help you get well faster is to make sure you stay hydrated. And we use those words a lot. So what is that definition of staying hydrated? What does that mean? Usually it means a minimum of drinking about 2 liters of water a day. And that equals about 8-ounce glasses or 64 ounces of fluids. So that's the minimum. So you can have more. And again, I say this without any thought that any plan that you guys have any other chronic conditions. Like if you have kidney failure or if you have chronic heart failure, there are times that doctors will limit how much liquid you should intake. But I'm just, with this, we're just planning that you don't have any of those. And we're just talking about staying well and with having diabetes. So staying hydrated. And one way you can do that is drink at least a half a cup to 3/4 cup every hour to 1 hour. So even if you thought every hour I'm going to sip on this glass of juice or this glass of Sprite, and you don't have to drink it all, because putting a lot in your stomach can actually make you feel kind of nauseous again. So if you're already feeling that way, but it's taking small sips, and try to make sure they're clear liquids. Those have, I don't know, they're just easier on our stomach. That's a lot of times what hospitals will do. They'll put you on a clear liquid diet when you come out of surgery or whatever. It's easier on your stomach to digest, and it just doesn't make you feel as sick, and it's not as heavy on your stomach. Water, tea, juice, and soda. And at this time, I realize a lot of times we talk about, low carb and sugar free, but I say to my patients as I meet with them that, at this time, if all you can drink is regular Sprite, then I encourage you to drink regular Sprite. What I often suggest is try to drink water, but when you get tired of water, then go to maybe that one thing you like, apple juice, and have a cup of it, and then go back to the water. Or cut the apple juice with some water. Do half apple juice, half water, and sip on it. So you're getting some sugar or carbohydrates in those, and not doing the no sugar, or the sugar free. If you need regular drinks during the time of illness, then do that. Just try not to overdo. Try to limit it with some water or unsweetened tea or something. But staying hydrated is one of the main things that is so important when you're not feeling well. You can go many days without food, but you can only go a few days without fluid or water. So, when you're sick and you have your sick day box all set up and everything's ready to go, you might ask yourself, when should I call the doctor? When should I call my diabetes care team? Like at what point should I be concerned? Some of the things I listed here, again, they may pertain to you. You may do a little bit different on low blood sugar, but we always say if your blood sugar is less than 70, give us a call. We'd like to know that. We'd like to know how often that's happening and when that's happening. If your blood sugar is over 250 for more than 2 checks, or in our case, if it's over 300, give us a call. It doesn't hurt to call us and talk to the nurse. If you're vomiting or you're unable to keep fluids down, If your fever is 101.5 or you're ill for more than 24 hours, go ahead and give us a call and we'll see if the doctor wants to see you and we'll see, if he has any suggestions. If you have diarrhea for more than 6 hours, severe pain in your stomach, chest pain, or have a hard time breathing, give us a call. If you have moderate to large amounts of ketones in your urine, and if you're not checking ketones, and a lot of times you're not, usually we have some patients who have type 1 diabetes might be doing that, but otherwise a lot of patients are not checking ketones in their urine. But all the other things can pertain. If you find these to be true, then definitely give us a call and we'll talk to the nurse, or you'll talk to me if you come here to Valley Professionals, but otherwise call your doctor. But another time is to call us is when you just aren't sure what to do. If you're just like, okay, I don't even remember, I'm so ill, I don't even remember all the things Jill talked about in that presentation, give us a call. We would be glad to talk to you. We have care coordinators at every site, sometimes more than one care coordinator. You can definitely talk to them. You can always talk to the nurse also that is with your provider, and if needed be, we'll get the provider to talk to you. So please, we always encourage to give us a call. And that's 24/7. I always tell all of our patients here at Valley that, and I'm sure this is true for all doctors and nurse practitioners, they have 24/7. So you call their office and somebody will call you back. Someone will talk to you. There's always a provider on call. I would venture to say that's true. That is 100% true here at Valley Professionals. So always give a call if you have a concern. So the main thing is don't wait until there's an emergency to make a plan. Don't wait until you're sick and wish that you had made a plan for sick day management. Some of the things you can get started on right now is make a list of all the medication you take. And I put here diabetic medication because we're talking about diabetes. But in reality, if you take any other medication, anything over the counter, make a list of it so that it is in, I know you might have that you take with you to doctor's appointments, but if we're talking about putting together a sick day box where you would have food and supplies that you need, and we're going to talk more about that here shortly, that's where you could also put that list so that everything is in one spot. And on that list, make sure you have the name of the medication, the current dose you're taking, and any dose adjustment if needed when you're sick. Maybe you and your doctor has already talked about this, and when you're sick, they have told you to change your medication in a certain way. Don't take as much mealtime insulin, or, decrease insulin by 1% or something when you're sick, or increase it when you're sick. I don't know. But if it's adjusted when you're sick, put that on there. If that doesn't help you, you may remember, but when you're not feeling well, it may be that you'll need it written down so you can just read it. You won't be able to remember it as well, or another family member might need to know that information, and it'll be one spot where they know to go to your sick day box or the emergency kit where everything is found. Also, in that on that same list, make a list of all your doctors and include their name and phone number. And also put in there how you contact them after hours. And again, here at Valley Professionals, you just call us, or you can call any one of our clinics. And if we're closed, it will send you to our after hours provider. So you can call any of the clinics, because that's, if you think about it, if you're at the Clinton Clinic, you know that number better than you would know our Rockville number, and the Rockville patients know the Rockville number. You call the number you're familiar with, and it will transfer you to the doctor on call. So that's how it works here at Valley Professionals. So if you do not come here, check out with your doctor. Hey, ask the nurse the next time, or call them today after this presentation and say, if I needed you after hours, what number do I call? So we talked a little bit about creating your own sick day box where you have all the food and supplies and things that you might need. And these are just some examples. It can be clearly just a plain brown box like we saw on that one slide. But if you want to get a little fancier, they actually have some boxes, and it can be emergency box written on it. And I like this middle box that actually has like raisins and some first aid stuff, some water. And then I like the clear box with the handle, because you could grab that and go, and you can kind of see what's in there. So that's kind of nice too. But again, like I said, it can just clearly be just a plain brown box that you get at the store. And the thing I encouraged all of our participants in our diabetic group, that we used to talk about this on they came on monthly visits, is just to have one and put it in one place, and don't use the stuff you put in it until needed. Because I think that's what they found was, oh, there's a can of chicken soup in my sick day box, I'll go ahead and use it. But then when they got sick, they didn't have what they needed. So try not to use it. But we're going to talk more about what to put in your sick day box. But, create your own emergency box, or you could call it a go bag, so that if you had to grab it and go, like if there was a family illness that you were called away from home, but everything that you might need was in that go bag, you could quickly grab it and go. If there was an emergency where there was a flood or a tornado or whatever, and you had to grab something and go, you could quickly grab it and go. It had everything you would need to take care of yourself for a few days. So one thing you could start doing is just making a list right now of what you might need, you know, like water, some basic foods, a first aid kit, some of your prescription medicine or over-the-counter medicines that you take, you know, source of warmth. You could put a blanket next to this, some kind of form of lighting, like a flashlight with batteries. You could keep this kit or the go bag in a location that's easy for you to get to and less likely to be damaged. Like, you wouldn't want to put something like this all prepared and ready to go in the basement. And then if, you know, you live near the Wabash River and there's a chance of flooding, and then it floods, you can't get to your basement. But it needs to be in a place you're able to get to easily, because if you're not feeling well, or if you're in, you know, in a hurry or whatever, you need to be able to get it quickly to get out. You would keep all your essentials in here. I mean, think about it. You can go without brushing your teeth for a few days, but you cannot go without insulin. So think of the things you have to have and keep those in this. Either that, or keep it in a box, keep it in the refrigerator where you can grab it and put it, because insulin does need to be refrigerated. So the rule of thumb is about a 3-day supply. As you make your list and gather your supplies, you'll make changes along the way. You'll realize you forgot you needed this, and you'll see things in your go box or your sick day box, like, I don't really think I want that in there. That's okay. Do that, tweak it along the way and make it so that it works for you. So if you're going to try to work on having a 3-day supply, at least for your diabetic medications and supplies during an emergency, or even during a sick day time when you can't get out to the pharmacy and even get your meds, I think the good thing is now, I think some of them at least are actually delivering, which is nice. But it's always a good idea to have a 90-day supply of all medication and a 90-day supply of all diabetic supplies. Think about your insulin syringes, pen needles, glucose meter test strips, and the lancets and the lancet device. If you have an insulin pump, making sure you have 90-day supplies for that. Have extra batteries for your glucometer. A glucagon kit is for low blood sugar, and we can talk more about that. There are other options, but having a glucagon kit in that emergency kit, alcohol wipes, glucose tablets or gel, a carb snack or protein snack, water. I mean, the list could go on. As I was writing this, I was running out of room, and the print was getting smaller, and I'm like, we could go on. And everybody's list is going to be a little different, but I think the top 2 things up there, the next time, if you're interested in doing this, the next time you're at your doctor's office, ask if you can have a 90-day supply. Most of the time, the doctors don't mind writing a prescription for that. A lot of times it's the insurance. Maybe some insurances only want to do a 30-day supply. So that's something that, you can ask your doctor, and you could get a 90-day supply. And that way you always have those on hand. And so with that said, you don't want to wait. If it's time for a pickup or a refill, you don't want to put that off till the day you actually need the medication or the diabetic supply, or you again will be possibly short. So always make sure you have a 90-day supply on hand, and pick up those refills as soon as as soon as they're ready. So keeping insulin cool, as I talked about earlier, that you can have a go bag, you can have a sick day box, but insulin does need to be kept cool. So, and this is a Frio company, is the name brand, and I'm sure there may be other name brands out there, but this one that I know of is pretty unique in that it only takes water to keep the little bag cool enough to keep your insulin and or any other diabetic injectables that you might be on that need to be refrigerated. It will keep them cool. So it doesn't take any electricity, it just takes some water. And it's a pretty simple thing where you just immerse the container thing that's in there in water, and whatever it is, it freezes or gets cold. You put it back in this bag, and then you put your pins inside, or your vials if you use insulin in a vial. So you don't have to have a refrigerator, and it actually keeps it cool for 2 days. It's reusable also. So after 2 days, you dunk that thing back in the water and then put it back in the little bag, and you're good to go again. Again, the name brand is Frio. You can see that on the tag there, but I'm sure there are other brands out there. Other options, because these can run around $30. I'm not sure if it's just for 1 or 2, but I saw that price as I was looking these up. But if you don't want to do that, there are those small lunch bag insulated lunch bags. Those are good to use. You can always have the cold packs, or if nothing else, if you don't have any of those, throw some of the frozen food in there, and you can put your insulin or the other injectables that need to be refrigerated in something like that. I would just caution you, never put insulin on something frozen. Always have a barrier, like put a washcloth or a towel between the frozen thing and your medication. You don't want to freeze insulin or your the injectables. But these things are pretty cool. They can be used. They're so, the pins fit right in there. The vials fit in with your syringes, and it can be reused over and over because it's just activated with water. So that's something you might want to think about getting. Again, it doesn't have to be this name brand, but it's something you could put in your emergency kit. So if you had to go, you could grab your insulin, dunk that in water, and you could put that in the bag and head out. So if we're talking about emergencies and we're talking about someone who has diabetes, how much do you plan for? I mean, how do you know how much to plan for? And like I said earlier, a minimum of 3 days is a supply of necessities. And calculate how much water and food you'll need, because those are two of the important things. Is for example, if you're thinking everybody eats about 1,200 calories in general, give or take, and if we're talking 3 days, you would multiply that times 3 days. And if depends on if it's just you, if it's 2 people in your family or however many in your family, multiply that, and that gives you an idea of how much you need to have with you or on hand to sustain your family for 3 days. Same thing for water. 64 ounces a day is the minimum. So if we're going to go with the minimum, multiply that times your 3 days, and again, times however many people you have in your family that you would want to, make sure. So it's just me and my husband now. So I would say times 2. However, I think, well, what if my son were to come home? What if there was an emergency, whatever, and he wanted to come home? Then I would multiply him times 3, because I would want to make sure I had that on hand for him also. So, if you have the room, it doesn't hurt to go ahead and think, well, what if we had people came by who needed help? You multiply it times a few more people so that you always have extra. So this is the minimum, and it's a place to start. It's a place to start thinking, do we have this? Do we have enough food on hand if there was an emergency for 3 days, if the electricity went out, we couldn't get in the stores, whatever, do we have enough to sustain us for 3 days? And same thing with water. Keep in mind, again, you can go a few days without food or less food, but water or something to drink is something you can only go, for food, I think that you can go a week or so, but with water, it's very few days. So keep that in mind. I think I would start with water and make sure I had that on hand and think about food later. So if you want to do some more research, this is where I found some of my information. Of course, the American Diabetic Association, if you go to their website, you just literally put in a search for emergency planning, something like that. But I got most of it from the Association of Diabetes Care and Education Specialists. Again, they used to be called the AADE, and they actually have specific handouts for sick day management for children with type 1, for adults with type 1, for adults with type 2, and a diabetes disaster response sheet. So there's all kinds of places you can go to. Even the Indiana Department of Health, I'm sure, has something on emergency planning. The CDC is definitely going to have something. Simply do a type in a search, in an internet search for emergency planning, and you're going to come up with so much information. And then, of course, you would specialize that to what areas that you need to think about. And in this case, if it's diabetes, focusing on it, but also focusing on everything that kind of around that, like food and water, but also making sure that you're focusing on what it's going to take to manage your blood sugar. So, I think the thing now is just to take some action. That simply you can get started by just taking time to assess how prepared are you right now, and how prepared are you and your family if something were to happen. We've been through the the pandemic. How did you do? Could you have done better? Is there any area that you could, I hate to bring this up, but seriously, at the very beginning, people were scrambling for toilet paper. And I was sitting around thinking, why is everybody scrambling for toilet paper? We keep toilet paper on hand all the time. So I didn't have to worry. I didn't have to run to the store. I didn't have to go to the store and see those empty shelves. Just seeing empty shelves can cause some people to panic because we're not used to seeing that. Well, if that happened to you, and if that causes you to be of concern, don't be of concern. Try to be prepared now. If there's toilet paper out there now, which I assume there is, if it's paper towel, if it's, disinfectant, whatever it is that you said, oh, I didn't have enough of that last time. I'm not telling you to go out and buy it, the whole store out. I'm saying have a few days worth of this so that you are prepared. And, that is a whole nother situation. That's not even anything as important as your insulin or your diabetic medication to keep your blood sugar under control. So think about it. If you're always waiting to the last minute for refills or running out, what can you do? Talk to your doctor, get that 90-day supply, and always try to have some on hand. Take those first steps to get a sick day box going, you know, or a go bag, whatever you want to call it, and begin filling it up. I mean, literally, if you get a box and start putting in chicken noodle soup when you go to the store, okay, I can get that. You know, some of those crackers, those peanut butter crackers, something that won't go bad, you know, that will last a while and has a long shelf life. Making sure you have stuff to drink in there those days that you're sick. If you like apple juice, they have those little 6-ounce apple juices. If you like applesauce, get the small little containers. Leave it in there so it's always there, and be thankful that you don't have to use it. And when it gets close to that expiration date, then, you know, maybe start using it or sharing it with someone else. But have those things on hand so that you don't come to a situation where you can't take care of yourself when you're ill because you don't have the means to. You don't have anything there at the house to eat that you like to eat. You don't have anything to drink. Your medications run out. Those are things we want to try to avoid. So it's, you know, right now it's taking that first step, do an assessment of where you're at and what you need to do to get better prepared. You know, by putting together a plan today, you can enjoy peace of mind in the days ahead. I think this is a personal thing, but I really think the more you can only plan so much. I get that. But the more you plan, the more calm you are. You know, people were running around so upset about empty shelves of toilet paper. And I was sitting at home thinking, why is everybody freaking out about this? Because I didn't need to. We'd already planned. There's a whole lot of other areas that we could plan better. And that's what I'm using as my checklist. But if you have a chronic condition like diabetes during a time of illness and during a time of crisis, whether it's an emergency or a family illness, blood sugar goes up with stress and with infection and with illness. So we want you to be even more prepared and planning ahead for those times, because we know that blood sugars can be even more difficult to manage. So it's even more important to be one up on that and to make sure that you're trying to stay ahead of it. Take one step at a time. It can be a sick day box that you get going and you put it in your pantry and it's there for hopefully that you never ever have to use. Get a little small bag and think about, well, if I did have an emergency in my area, what would I want to put in it so that I could just grab it quickly and get out the door. So if there's anything else that you guys can think of, if you want to send something in the chat, that would be great. This is just kind of a general overview of what to do during those times of emergencies and during sick days, so that you can all feel a little bit more confident with self-management. And you know, in the end, your doctor's offices are always there for you. So give us a call if you have any concerns, or if anytime you want more help with this, you can always call and we could definitely talk some more about it. So there are no questions or anything listed in the chat box. So if that's it, we will close for now. And like I said, you can always call us if you want to talk more, get some more ideas, throw some more ideas around. And I'm not sure if we're going to have another one of these in December. So keep an eye. I guess you'll get a text message or an alert through your email if we get one put together. And if you have any suggestions of like what you would like to see for a presentation, then definitely send a chat message now so that we know what you're interested in learning more about. Thank you all so much for coming today and giving your time. And I hope there was something that you can take away from this. Thank you. Have a great day.